Slip capital femoral epiphysis, also known as SCFE, is a hip condition that occurs in teens and preteens who are still growing. For reasons that are not well understood, the ball at the head of the femur, thigh bone, slips off the neck of the bone in a backwards direction. This causes pain, stiffness, and instability in the affected hip. The condition usually develops gradually over time and is more common in boys than girls. Treatment for SCFE involves surgery to stop the head of the femur from slipping any further. To achieve the best outcome, it is important to be diagnosed as quickly as possible. Without early detection and proper treatment, SCFE can lead to potentially serious complications including painful arthritis in the hip joint and hip replacement or blood clots. The hip is a ball and socket joint. The socket is formed by the acetabulum, which is part of the large pelvis bone. The ball is the femoral head, which is the upper end of the femur thigh bone. Like the other long bones in the body, the femur does not grow from the center outward. Instead, growth occurs at each end of the bone around an area developing cartilage called the growth plate, physis. Growth plates are located between the widened part of the shaft of the bone, metaphysis, and the end of the bone, epiphysis. The epiphysis at the upper end of the femur is the growth center that eventually becomes the femoral head. SCFE is the most common hip disorder in adolescents. In SCFE, the epiphysis, or head of the femur, slips down and backwards off the neck of the bone at the growth plate, the weaker area of bone that has not yet developed. SCFE usually develops during periods of rapid growth shortly after the onset of puberty. In boys, this most commonly occurs between the ages of 12 and 16. In girls, between the ages of 10 and 14. Sometimes SCFE occurs suddenly after a minor fall or trauma. More often, however, the condition develops gradually over several weeks or months with no previous injury. SCFE is often described based on whether the patient is able to bear weight on the affected hip. Knowing the type of SCFE will help your doctor determine treatment. Types of SCFE include stable SCFE and unstable SCFE. In stable SCFE, the patient is able to walk or bear weight on the affected hip, either with or without crutches. Most cases of SCFE are stable slips. Unstable SCFE, this is a more severe slip. The patient cannot walk or bear weight even with crutches. Unstable SCFE requires urgent treatment. Complications associated with SCFE are much more common in patients with unstable slips. SCFE usually occurs on one side. However, in up to 40% of patients, particularly those younger than age 10, SCFE will occur on the opposite side as well, usually within 18 months. The cause of SCFE is not known. The condition is more likely to occur during a growth spurt and is more common in boys than girls. Risk factors that make someone more likely to develop the condition include excessive weight or obesity. Most patients are above the 95th percentile for weight. Family history of SCFE, or an endocrine or metabolic disorder such as hyperthyroidism. This is more likely to be a factor for patients who are older or younger than the typical range of SCFE, 10 to 16 years of age. Symptoms of SCFE vary, depending upon the severity of the condition. A patient with mild or stable SCFE will usually have intermittent pain in the groin, hip, knee, and or thigh for several weeks or months. This pain usually worsens with activity. The patient may run or walk with a limp after a period of activity. Parents usually mistake this complication with growing pains or any other pains within your leg area. In more severe or unstable SCFE symptoms may include sudden onset of pain, often after a fall or injury, inability to walk or bear weight on the affected leg, outward turning or external rotation of the affected leg, and discrepancy in leg length. The affected leg may appear shorter than the opposite leg. Like I said, unstable SCFE is much more severe than stable SCFE. The rate of osteonecrosis is as high as 20 to 50% in patients with the unstable form. Treatment goals are similar to those of stable SCFE in situ fixation, but there is controversy as to the specifics of treatment, including time of surgery, value of reduction, and whether traction should be used. Now, this is a picture of a slight slip on the head. This is a picture of the hip getting of the pins inside the femoral head, which therefore treated the complication. Chondrolysis is the acute loss of articular cartilage, which causes joint stiffness and pain. It is usually reported as a complication of surgical treatment of SCFE, but it can occur with the use of a hip spica cast in untreated advanced SCFE. With the improvement of surgical techniques, the incidence of chondrolysis has decreased from a rate of 5 to 7% to a rate of 1 to 2% in patients treated for SCFE. Another complication is avascular necrosis. Avascular necrosis occurs in up to 60% of patients with unstable SCFE. It is a serious complication associated with severe displacement and fixation with more than one screw. Avascular necrosis often leads to early and advanced and early degenerative osteoarthritis. Thank you.